You may have heard about Kegel exercises, but do you actually know how to do them correctly? I'm Rena, a urologist and pelvic surgeon, and today we're going to talk about Kegel exercises for men. Yes, that's right, they're not only for women. If you've been curious about improving bladder control, supporting your prostate, or even boosting things in the bedroom, you're in the right place. In this video, we'll explain what Kegels are, why science shows they can work, who can benefit from them, and who might want to avoid them. So what exactly are Kegel exercises? Imagine your pelvic floor as a hammock-like layer of muscles, or even a bowl-shaped group of muscles that stretches from your tailbone to your pubic bone. These muscles, especially one called the pubococcygeus, or PC muscle, support the bladder, prostate, and rectum. They play a key role in helping you urinate, control bowel movements, and maintain healthy sexual function. They're also an important part of your core, contributing to stability and normal body function. Kegel exercises are straightforward movements designed to strengthen this muscle hammock. They were named after Arnold Kegel, who first introduced them in 1948, and they're essentially one important exercise used in pelvic floor muscle training. Originally, these exercises were created for women to help with urine leakage after childbirth. However, they are just as important for men. Just like in women, men can experience weakening of these muscles because of aging, prostate surgery, diabetes, and other health conditions. When that happens, it can lead to problems such as urine leakage and sexual difficulties. The encouraging news is that several studies have explored how effective Kegel-type exercises can be for men. In 2005, researchers examined how pelvic floor exercises might help restore erectile function. The study was a randomized controlled trial involving 55 men with ED, also known as erectile dysfunction. The group receiving treatment practiced pelvic floor exercises along with biofeedback, a method that uses sensors or patches to show how strongly the muscles are contracting and whether they're being used correctly. Meanwhile, the control group only received lifestyle advice. After 3 months, the men who performed the exercises showed significantly greater improvement in erectile function compared with the control group. By the 6-month mark, about 40% of them had regained normal function. The researchers also observed a clear reduction in post-void dribbling, that small amount of urine that sometimes leaks out after you finish urinating, in the group that practiced the exercises. Now, all of this may sound very promising, but it's important to talk about the limitations as well. In that study, a fairly large number of participants, about 40%, dropped out before the research was completed. This matters because these exercises are like any other form of exercise. You have to stay committed and practice them regularly, otherwise they simply won't be effective. They can also take time, and some people feel discouraged when they don't notice improvement right away, which leads them to stop doing them. Just like with other muscle groups, some people find it harder to build strength than others, especially if those muscles start out very weak. So the key point here is that real improvement usually requires patience and consistent effort. Let me share another piece of research with you. In 2019, a systematic review by Myers and Smith examined 10 different studies and found that, overall, Kegel exercises helped improve erectile dysfunction, as well as premature ejaculation. When it came to erectile dysfunction, all 5 clinical trials reported improvement, and some even showed cure rates of up to 47% when the exercises were combined with biofeedback or muscle stimulation techniques. Regarding premature ejaculation, one study reported that 55% of men, 43 out of 78, completely resolved their condition. Another study found that the average ejaculation time increased from 39.8 seconds to 146.2 seconds among 40 men who practiced the exercises. One of the most common times urologists recommend these exercises is after a prostatectomy, which is surgery to remove the prostate. After this procedure, some men experience urinary leakage, especially when they cough, sneeze, or lift something heavy. Several studies have shown that performing pelvic floor exercises can reduce the amount of urine leakage over a 24-hour period. However, the research also suggests that the best results occur when the exercises are done with guidance from a certified pelvic floor physical therapist. In many ways, it's similar to going to the gym with a personal trainer who ensures you're doing everything correctly. Finally, although there isn't a large amount of scientific evidence on this yet, these exercises might also increase orgasm intensity. The reason is simple. Stronger pelvic floor muscles may contribute to greater sexual pleasure. When you reach climax, your pelvic floor muscles naturally contract. If those muscles are stronger, the contractions can be more powerful, which may lead to a stronger and more satisfying climax. So, who can benefit the most from these exercises? They're particularly helpful for men dealing with erectile dysfunction, men who struggle with premature ejaculation, and those experiencing urinary leakage or other issues following prostate surgery. So how can you tell if you might have pelvic floor dysfunction? If you experience ongoing pain in your genitals or pelvic region, discomfort during orgasm, ejaculation or erection, persistent constipation, or frequent urinary problems such as urgency and frequent trips to the bathroom, it's best to get checked by a medical professional first. Before starting Kegel exercises on your own at home, it's important to rule out any pelvic floor dysfunction. Also, if you've recently had surgery or are dealing with a urinary tract infection, it's wise to wait until you've seen your doctor, received proper clearance, and the infection has completely healed before beginning these exercises. First things first, we need to understand exactly which muscle group we're working to strengthen. Many men don't even realize they have a pelvic floor, so please excuse the visual explanation, but this will help make things clearer. If I lift my leg like this, the muscle group we're focusing on is located right beneath the scrotum, in the crotch or groin area. This region is called the perineum. If you gently lift your scrotum, you'll notice a soft, spongy section of skin just underneath it. Again, I know the visual might feel a little awkward, but it helps to know exactly what we're referring to. That spot is your perineum. It's the area we want to strengthen to help improve erections and reduce any urine dribbling. It's also the area we need to feel, what medical professionals call palpating, to make sure the exercise is being done correctly. If you don't know what you're supposed to feel, where you should feel it, or how strong the sensation should be, it's difficult to know whether you're actually activating the correct muscles. So how do you figure out what to feel? Start by using 2 fingers from your dominant hand. I'm right-handed, so I'll use my index finger and middle finger like this, similar to the position you'd use if you were checking someone's pulse. Now don't worry, we're not taking a pulse in this video. Instead, we're going to use these fingers to locate and feel the perineum. If you're sitting down watching this video on a couch, chair, or office seat, move yourself all the way to the edge of the chair so that your scrotum and penis can hang slightly off the front. All right? At this point, only your sit bones should be touching the chair. Next, take those 2 fingers, gently lift your scrotum, and place your fingers directly on top of your perineum, like this. If you can see where my fingers are, you'll notice they're simply pressing upward lightly. You don't want to push hard or dig in, just rest them there. Good. Okay. Now with your other hand, simply place it on your knee. Take a moment to relax. Breathe in slowly and then breathe out. Now we're ready to begin. You might be wondering, Eric, why do I have my 2 fingers placed down there? The reason is simple. What you're trying to notice is either a slight bulging sensation against your fingers or a gentle tightening of the skin underneath them. If you feel any kind of movement under those 2 fingertips, that means your pelvic floor muscles are contracting. That's exactly what we're trying to achieve. If you don't feel anything yet, that's perfectly okay. Don't worry about it. It just means you may need a little more practice. I like keeping 2 fingers there because it helps confirm that the muscles are activating properly. So let's reset. 2 fingers resting over the perineum. Your free hand placed on your knee. Your body relaxed. Now we're going to use a simple phrase to help trigger the muscle contraction. Remember, we can't actually see these muscles. It's not like working with your biceps or triceps where you can watch them tighten and relax. And honestly, I could probably use a little more work on my biceps myself. Because we can't see these muscles, these exercises require a bit more concentration. In a moment, I'll ask you to close your eyes, but not just yet. Keep your 2 fingers in place, your other hand resting on your knee. Sit up straight and keep your feet flat on the floor about shoulder width apart. Now here's the first cue. I want you to imagine that you're stopping the flow of urine. Picture yourself standing at a urinal and suddenly needing to stop the stream. Then relax again. Close your eyes. Take a breath in, then breathe out slowly. Let all the air leave your lungs. Once the air is completely out, imagine stopping the flow of urine. Then release and relax. Take another breath in. Breathe out again. When your lungs are empty, stop the flow of urine and relax. Under your 2 fingertips, you should feel a small flicker, a slight bulge or tightening of the skin. That's the muscle activating. Now, if you're just starting out on your journey to strengthen your pelvic floor, it's completely normal if the contraction doesn't feel very strong yet. These muscles likely need some conditioning. That's probably why you're watching this video in the first place. And that's okay. Don't stress about it. With time and consistent practice, the strength of that contraction will gradually improve, and you'll begin to feel it more and more clearly. Now, if you didn't feel anything at all, I'm going to guide you through another phrase that many people find helpful. This next one works well for a lot of beginners. I want you to close your eyes and imagine walking into an ice-cold ocean. The moment the cold water touches your scrotum, you get that sudden feeling where your genitals seem to pull upward toward your body. That's the sensation we want you to copy. So, let's try it again. Fingers placed over the perineum, your free hand resting on your knee. Sit upright with good posture. Take a deep breath in. Now breathe all the way out. Once your lungs are empty, say to yourself, lift your nuts to your guts. Then release and relax. Let's do it one more time. Big breath in, big breath out. Lift your nuts to your guts and relax. It should feel like everything tightens together and then gently releases. Here's another simple way I sometimes help people picture what to do during a Kegel exercise. Imagine trying to lift your penis slightly off the ground without touching it, or think about the feeling of holding in gas. The key is making sure you're not squeezing your butt muscles or tightening your stomach muscles, because the goal is to focus only on those pelvic. Once you feel comfortable doing them lying down, you can move to practicing them while sitting, and eventually while standing. To start, I usually suggest that men perform a set of 10 repetitions while sitting. That means 10 breathing cycles. Breathe in, breathe out. Then either imagine stopping the flow of urine or use the phrase, lift your nuts to your guts. Relax afterward. Think of it like flipping a light switch. On, then off. At this stage, don't try to hold the contraction yet. Your muscles aren't ready for that. If you push too hard too soon, you may actually tighten the pelvic floor in the wrong way, which works against strengthening it. So start slowly. Close your eyes while practicing. Focus on quality rather than quantity. Each time you do the exercise, keep your fingers over your clothing and positioned above the perineum so you can make sure you're getting a proper contraction every time. Eric shared one last important message. Strengthening your pelvic floor muscles can sometimes feel frustrating, especially in the beginning. If you're just starting, try not to be too hard on yourself. Take a breath, stay patient, and dedicate a small amount of time each day to practicing your Kegel exercises. A good starting point is 30 repetitions per day. That could be 10 in the morning, a quick on and off contraction, 10 in the afternoon while sitting, and 10 more at night while sitting. Think of it as flicking a light switch on and off. Continue with those 30 repetitions until you feel comfortable with the movement. You'll know you're ready to move forward when you can clearly feel the contraction engage and then fully release. It may take a little time, and many of us want to rush the process, but with the pelvic floor, patience is essential. Progress happens gradually, so give yourself time. And as always, take good care of yourself, because you truly deserve it.